All right, how's it going, everyone? Welcome to another episode of Forward Thinking Founders, where we talk to founders about their companies, their visions for the future, and how the two collide. Today, I'm very excited to be talking to Seb Poole, who's a co-founder of Frankie Health. Welcome to the show. How's it going?
Great, Matt. Thanks for having me on today. Looking forward to chatting.
Yeah, I'm looking forward to learn more about what you are working on. For people that haven't heard of Frankie Health, what is it? What are you working on?
Cool. So Frankie Health is about personalizing employee mental health care. So we're looking at how we can introduce better mental health solutions in the workplace with the changing dynamics of global companies working remote and on-site.
So walk me through, let's say I was a CEO of a large company, I had employees, or I was an employee of a large company. Like, tell me through, like, what does this look like if I was to be a customer of yours, or what's the user experience of kind of using Frankie Health?
Yeah, cool. So everyone gets access to a web-based platform at the moment. We're looking at introducing mobile quite shortly, answering a couple of clinically backed questions and surveys to just get an understanding of how you are in terms of your mental health and where you are on our wellness score scales. We have digital content in the platform, digital activities that we've mixed up with machine learning so that they can give you insights straight off the back of doing the activities themselves. And then we have a huge catalog, a growing catalog of therapists and coaches that you can jump on and get access to as well. We're not geographically constrained. So for a global workforce, you can really get access globally to support when you need it. Integrating in with common workplace tools like Slack, Google Calendar, and so forth as well. We really pop up and we're there that when you need mental health support, we're the one to go to.
So walk me through a little bit about the origin story here. Why did you decide to start Frankie Health?
Cool. So my co-founder and I actually met in Bali. We were there working on a trip together to support the government reducing the use of plastic bags. And I was previously working on another startup that we sold last year. And I mean, we both really had a view of mental health really needed to be transformed. Coming from the startup environment as well, you know, I've been in the high pressure zones and dealing with employees in those early stages, really also kind of struggling through the process. And there needed to be a better way to do it. After selling the company last March, you know, COVID hit, and we're all kind of changing the way that we're going about our lives. So really reflecting on where we were, speaking to my co-founder Jimmy, and piecing together what we could really do in this space. We saw the opportunity of being able to provide better service in organizations and build a platform there that's going to be a little more intelligent and provide something more than just a check of the box in organizations for mental health. So we really wanted to be able to help destigmatize mental health in organizations, but then also, really provide valuable exercises, insights, and support to those in there. It's something that's close to heart. I mean, we've all got stories of family members who've gone through mental health. So, there's a huge background there and something that's really close to heart.
What's one thing or two things or however much you want to share, but as you started this company, what have been a couple of things that you've learned along the way? It could be about building a company for the second time or like the market itself or building the product, but what have you learned about kind of this space that you maybe didn't know beforehand?
Yeah, I think in terms of the space, there's a lot that you really have to look into in terms of the UX or the way that you build out your technology or the platform for mental health specifically. There's a lot there that you need to be more sensitive of on how the user experience is going to work their way through a platform and engage with that. I think in terms of building a second company, I mean, we're building in a very interesting time as well. We're born through COVID, funded through COVID. And so a lot of our team is remote this time when, previous startups that I've worked on, we've made sure that we've kept it all in-house. So there's very much a learning lesson on how to coordinate distributed teams. My co-founder is based up in Dublin. I'm down here in Melbourne, Australia. So, we're working different time zone differences, having split teams. How do we document everything that we're going through, but still grow at a pace that we need to without sacrificing any of the quality that sits there as well. Plenty of learning lessons.
And if you were to kind of take what you're doing here and zoom out, a lot, 5 years, 10 years, 15, 20 years, as far as you want to go, what does the future look like kind of with Frankie Health? Or I guess, in other words, what's the big vision with what you're working on and what direction are you rowing in every day?
Cool. I mean, as I mentioned before, mental health in organizations is largely a check of the box. And what we see is that we really need to deliver a solution that's going to be integrated into organizations and the go-to cause so that it actually assists people in their own mental journey alongside their workforce journey as well. So where we see Frankie Health moving is essentially, I think, from a high level, being able to destigmatize mental health and allow people to talk about it in organizations. As a secondary, and the mission of how we want to do that, we want to personalize and really focus on precision medicine, which is a key thing. I've got a background in technology, machine learning, and so forth. So bringing that into how we deal with ourselves, how we understand ourselves, and empowering ourselves as individuals to bring the best out in our contributions to the workplace, but also in ourselves and work-life balance. So for us, it's we really want to transform from being a check of the box to being something that's really important in organizations, that, instead of being a well-being program that really does not contribute and is secondary in people's lives at organizations, that where they're providing a lot of value and insight to the employee.
And to make it happen, which is a really important thing that you're doing, and to make that vision kind of come to life, you'll need some help, right? It takes a village to make a startup work. So my question for you is, how can the forward-thinking founders community help? Are you hiring? Are you looking for capital? Are you looking for customers or partners? How can we assist?
Beautiful. We're fortunate to have some fantastic investors on board that are very, very interested in the space. We're not raising at the time, but always open to conversations and that for future rounds. We're hiring at the moment quite aggressively on the engineering side, as most startups are, and also the product design side. But anyone really interested in the mental health space that's open to a collaboration, that feels like they might fit into our picture of being able to deliver, exceptional mental health journeys in organizations, or anyone that's working in a different domain in the startup space that might be looking for a future role, be sure to get in contact, because we love working with passionate people.
And then for my last question, if someone does want to get in contact, they're interested either in investing or working with you, or, you're working for you, et cetera, how can they find you online? What's your website? Do you social media? Do you have an email address? How can they get in touch?
Cool. Drop by frankie.health, all one word URL. Otherwise, you can pop a message through on LinkedIn. Seb Poole, my LinkedIn as well. It's public up there. If you want to send an email, more than happy to get back.
Cool. Well, thank you so much for coming on to the podcast. I really appreciate it.
Fantastic. Thanks, Matt. Really appreciate it.